Hey friends, I'm so glad you found me. I'm Stephanie Carter Kelley, a physical therapist who uses yoga in just about everything that I do. And I'm bringing you this magic pill series for chronic pain. Today we're going to talk about the magic pill for back pain. I've developed this series by using little bits of movement in my yoga class. I do an activity, so for back pain I might have people forward bend and backward bend, and then I give them this dosage, this small dosage of exercise, and then we test it again, forward bending, backward bending. And what I've seen is that people immediately have some relief from their back pain by doing a small dosage of exercise. So today we're going to focus on movement in different situations for back pain. So I'm going to give you a complaint that many of my clients bring to me, and we're going to talk about strategies that you can use throughout your day when you specifically feel pain, immediately using that dosage of exercise to relieve your pain. So the first one is people complain that they have pain when they're getting out of bed in the morning. So if you're that person, I want you to think about, okay, maybe you sleep on your side, maybe you sleep on your back, but you're gonna roll onto your back and keep the knees bent. And you're gonna start just gently moving your back by rocking the pelvis. So this is pelvic tilts. And you can use the muscles of your core, or you can use your legs. You can push into your legs, which will rock your pelvis back, flatten your back. You can pull into the legs, and that will arch your back. So you want to not slide on your bed, but you can just gently push and pull. Push and pull, leaving everything through the spine nice and relaxed. You're just using the muscles of the legs to create some movement through the pelvis and through the low back. And you control how much movement or what the dosage of movement is according to how you feel. So if you push or engage your core to flatten your back and that brings some discomfort, then you back off. You don't want to push into discomfort or pain. If you arch and you feel discomfort, then you can just go through this tiny little bit of movement. But as you do several repetitions, you might grow the movement and feel like, okay, as I move, I'm feeling a little bit better, and so I'm going to do a little more of an arch, a little more flattening, and that's okay. It's all about how you feel. You are empowered to take control of this movement, of this dosage, of this pill or this medication for your own comfort, your own amount of pain. So once you've done it several times and you feel like you've loosened up a little bit, then you roll over onto your side and you come to sitting at the bedside. So I'll just simulate that. Sitting in the chair. So now you've rolled over, swung your feet onto the floor. Now you're sitting on the side of the bed, feet are on the floor. And again, you can kind of create that same movement, that pelvic tilting at your bedside before you then even go to stand up. You want to make sure that you get this extension. You want to get the arching through your back, because as you go to stand up, standing is all about extension through the back. But in sitting, you can get a lot more motion. So you grow the motion while you're lying on your back, and then you come to sitting and you grow the motion again. This one is also good for those folks that have pain while you're sitting at work. So you're working at your computer and you sort of notice the discomfort in your back, but you're working, so you can't get up or move around. You can rock your pelvis, move your low back into the flattening and the arching, while you're sitting and working, while you're talking on the phone. You can move. You don't have to be so static while you're sitting. I know there's a lot of folks with the standing desks, but maybe you're in the middle of something and you don't have time to transition. You can move. This is also good for when you're driving. A lot of people tell me that, maybe for short distances, their back feels okay, but when they go to drive long distances, their back begins to hurt. So again, you're driving, you can easily get this rocking through the pelvis and through the low back. Your back likes to move. So this little bit of oscillation of movement gives you some good nutrition, gives you some circulation into the back so that it's not screaming for oxygen and it can feel better. So it's just that little bit of movement, and you kind of, you're activating your core a little bit through the front and the back side of the body, so the muscles have some pumping action, and your discs need that movement to create the nutrition. So as a regular activity, and for anybody who really has some low back pain, you can also do cat-cows, the true cat-cow, on the floor, on all fours. So wrists under the shoulders, knees under the hips. And keeping those elbows nice and straight, allow your spine to just fall between the shoulders and the hips, and then you round it. Engage the core, rounding that small of the back up towards the ceiling, and focusing on this lower area and what the pelvis does in order to create movement through the low back. What I've noticed in my yoga classes is people have the ability to really sink into this arched position. They don't a lot of times have the ability to really rock and flatten the back out. So working on some extensibility of those tissues that may be tight, around the small of the back and into the hips, this is a good position to do that. So even though this is one type of exercise, it comes in many forms. And so here you have 3 different ways to really do the cat-cow or the pelvic tilts. And some of you might only know posterior pelvic tilt, which flattens the back, but you might also need that anterior pelvic tilt, what gives you the extension. We spend time in extension, whether we're standing and walking throughout the day. So you want to get that motion in all different positions. So if you like this video and would like to share it with somebody, feel free to do that. Tap on the bell so that you get alerts every time I create a new video. And subscribe to my channel so that I can continue to grow this channel and bring you more information about how to take control of your own body and your own sensations. That's what I really am trying to give to you, are all the tools that you need to carry on without letting pain be such a big part of your life. So if you need a different dosage, if you feel like you need a different exercise, if this is not exactly right for you and your condition, you can go to the American Physical Therapy Association and use their search function. Find a PT to find someone in your area who can help guide you and give you a better prescription of movement and exercise and dosage and intensity for you. I'm Stephanie Carter Kelley, a physical therapist and a yoga teacher. Namaste.